Okay. So when the brain is deprived of this rich oxygenated blood, the cells will eventually die, and this can lead to what we call stroke. And they said mostly it's for certain period of time, and that time can be within 5 minutes. If the cells are not able to get rich oxygens, okay, within 5 minutes, our brain cells will start to die. So stroke occurs when the blood rich in oxygen cannot reach our brain cells, okay, leading to cell death after a certain amount of time. And that can be even within 5 minutes of the cell not getting the oxygen rich blood. These cells can eventually die. Okay, so what are some of the possible causes? What can cause these blood vessels or these cells not getting the amount of blood? So one, blockage of blood flow, okay, through the carotid and the vertebral artery. One thing we have to know, okay, is that there are two main arteries that supply the brain with oxygen, and that is the carotid and the vertebral artery. Okay, so if there is a blockage within these arteries, then it's going to affect blood flow to the brain. Okay, and this can lead to stroke. Okay, so what are some of the types of the blockage? So vessel blockage, which prevents oxygenated blood from reaching the brain cells. Okay, when the vessels are blocked. Okay, and the blockage can lead to brain tissue death, resulting in severe consequences. Or when there is a rupture of the blood vessel. So one, it can either be a blockage or a rupture of the vessels, and the blockage can be in different types, which we are going to talk about it. But just have it in mind that mostly if the carotid and the vertebral artery, which supply the brain with oxygen, is being blocked, and these cells are not getting the needed amount of oxygenated blood, then these cells are going to die and eventually result in what we call stroke. So there are three types of stroke. We have the ischemic stroke, the hemorrhagic stroke, and the TIA. Okay, so we are going to take it one after the other. One is the ischemic stroke. So when we say ischemia, what is ischemic stroke? It just simply occurs when there is a blood clot obstructing the blood flow within a vessel that feeds the brain. So if there is a clot blocking the vertebral or carotid artery, preventing oxygenated blood from getting through to the brain cells, these can lead to what we call ischemic stroke. So basically, ischemic stroke is when a clot blocks these arteries, preventing the brain from getting the oxygen-rich blood. And these clots can be either embolism or thrombosis. Okay, when we say embolism, basically is when the clot travels from some part of the body to that vessel. So let's say you have endocarditis and there is a clot formation in your valves, and these clots transfer or transport from your valves to come and block these carotid and vertebral artery. It can lead to what we call embolism. Okay. So basically, the embolism, it means that the clot travels from other parts of the body to come and block the. Can we mute, please? So basically, when we say embolism, when in terms of ischemic stroke, it means that the clot that is blocking the artery, either the carotid or the vertebral artery, that particular clot traveled from somewhere within the body. So, for instance, it can be just like I said, it can even be when you have atrial fibrillation, where there is clot formation within the atrium, and then it travels to come and block the arteries within the brain. That means you are getting ischemic stroke as ischemic stroke as a result of embolism, because these clots traveled from somewhere in the body. So, example, a patient with heart valve problem or atrial fibrillation, where there is quivering of the atrium causing blood pooling, and this blood pooling can form clots, and these clots can dislodge from the atrium to the brain, and this can cause or deprive the brain cells from getting the needed amount of blood, and therefore we are going to say that patient is having ischemic stroke associated with embolism. And we have the other one called thrombosis. So when we say thrombosis, it's a clot that forms within the arterial wall. Okay, so when the carotid, within the carotid artery or the vertebral artery, when there is clot formed within that particular place as a result of either atherosclerosis, when you have hyperlipidemia, and these cause clot to be formed within that particular artery, that is the artery supplying the brain with the oxygen, then we say that clot is as a result of what thrombosis. So basically the thrombosis forms within the artery supplying the brain, but the embolism means the clot traveled from somewhere else within the body. Okay, that's what I've given you an example. If you have atrial fibrillation, we know in atrial fibrillation there is quivering of the atrium causing blood pooling, and this can result in clot formation. And if this clot dislodges into the artery supplying the brain, like the carotid and the vertebral artery, then the brain cells is being deprived of the needed oxygen. Then that particular type of stroke is ischemic stroke associated with total embolism. When we say thrombosis basically means that that clot that is being formed was formed within the carotid and the vertebral artery. It didn't travel from any part of the body, but it was formed within the carotid or the vertebral artery. Okay, so that is what I said. Some of the causes can be probably from hyperlipidemia, atherosclerosis, where there is accumulation of plaque, and this can result in clot formation within the artery supplying the brain with oxygen. But if the clot that is being formed traveled from somewhere else in the body and came to dislodge within this artery, then we say it is an embolism. So we've talked about the first type of stroke, the ischemic stroke, and I've explained to you that under ischemic stroke, we have the embolism and the thrombosis. And I've explained that the embolism basically means that the clot traveled from somewhere within the body to come and dislodge within the artery supplying the brain with oxygen. Thrombosis is basically means that that particular clot that is being formed within what the arteries that is supplying the brain. It didn't travel from anywhere, but it was formed within the arteries supplying the brain with oxygen. The other type of stroke that we have is the hemorrhagic stroke. Okay, so that's the second type of what stroke. So the ischemic stroke is basically a clot forming, blocking the carotid or the vertebral artery, preventing the brain cells from getting the oxygen-rich blood. Then as a result, these brain cells will die and then they will cause stroke. So that is the first part of stroke called the ischemic stroke. So we're going to talk about the second one called the hemorrhagic stroke. So it occurs when there is bleeding within the brain caused by a rupture in the brain, in the blood vessel. So when the blood vessels that is supplying the brain, let's say there is a rupture, there is a trauma within these vessels, and the blood that is supposed to feed the brain cells is rather leaking. Okay, so it's not going into the right place. It can even cause what? Swelling within the brain, because this blood is leaking into the brain but not feeding the blood cells that need this amount, that need this oxygen. So basically the hemorrhagic stroke is when the bleeding is the stroke is as a result of what? Hemorrhage. And this hemorrhage results when there is a rupture within these blood vessels. As a result, this bleeding will go to somewhere else. It will bleed into the brain cells, into the brain, rather than feeding the brain cells. Then we say the stroke is as a result of what? Hemorrhagic stroke, or as a result of what? Bleeding. So consequences, it leads to lack of perfusion to the brain cells and excessive swelling due to what? Blood leakage. So with the hemorrhagic stroke, just have in mind that it's as a result of what? Bleeding. The vessels has been ruptured. There is a trauma to the vessels, and these vessels are unable to supply the brain with the needed amount of oxygen. Then that particular stroke is as a result of what is called what? Hemorrhagic stroke. And what are some of the causes? We've already known that the ischemia is as a result of blood clots, and these blood clots can form through atrial fibrillation, through valve problems. Okay, and we've talked about various hyperlipidemia, atherosclerosis. When we come to hemorrhagic stroke, what can cause bleeding? What can cause these vessels to rupture? We can have what we call the brain aneurysm if there is what? Weakening of the blood vessels. Okay, the weakening of these blood vessel walls that bulged out. So when there is aneurysm and eventually these aneurysm burst, it can lead to what we call the hemorrhagic stroke, because these vessels that have been ruptured, the blood is going to drain into the brain instead of going through the brain cells. Instead of feeding the brain cells with these amounts of blood, these blood will be leaking into the brain. Okay, so there will be brain swelling and other things. So brain aneurysm can cause what we call hemorrhagic stroke. Uncontrolled hypertension. If your blood pressure is high, more than 200, okay, high blood pressure can weaken your blood vessels. If our blood pressure is high, this excessive blood pressure can cause pressure within the vessels, weakening the blood vessels, and eventually these blood vessels can break, okay, and it will lead to what? Hemorrhage. And if this hemorrhage happens, it means that the brain that is supposed to get the oxygenated blood is not getting this blood, and as a result can lead to what? Brain death, leading to what? Stroke. Old age. We all know as we old, their blood vessels become what? Less resilient. They become less weak, impacting on the integrity of the blood vessels, and as a result, increase to the rupture of what? These blood vessels, causing what? Hemorrhagic stroke. So just know that when we talk about ischemic stroke, it is basically caused by what? A blood clot. When we talk about hemorrhagic stroke, it's basically about a rupture within the blood vessels, depriving the brain cells from getting what? The needed amount of what? Blood. This rupture is going to leak blood into what? Into the brain cells, into the brain. Okay, causing brain swelling and others. But rather, the cells that need this blood is being deprived. And as time goes on, these cells are going to die, and it's going to lead to what we call what? Stroke. So we have one, the ischemic stroke. We have another one called the hemorrhagic stroke. And the third one we are going to talk about is what? The transient ischemic stroke, which we call the TIA. Transient ischemic stroke. So a transient ischemic attack is a type of ischemic stroke that serves as a warning sign. So basically you have a small clot which is not really occluding the entire carotid or the vertebral artery that is supplying the brain. Let's say there is a small clot, and these clots with time is going to deprive the brain of getting the needed amount of oxygen. With time, the patient can get an episode or a period of a stroke because they're not getting all the needed amount of blood. Let's have in mind that this transient ischemic stroke, because the clot is not occluding the entire carotid artery, it is still going to get some amount of blood, just that it's not enough. And these can cause certain parts of the brain cells to die. And if care is not taken, though it's going to resolve, but you need to make sure that whatever is causing it, if it's a clot, if it's hemorrhage, you need to make sure that you intervene so that it doesn't aggravate to the other type of stroke. So with the TIA, it just happened. It is temporal. It is not permanent like the hemorrhagic and the ischemia. So just have in mind that a transient ischemic stroke is a type of ischemic stroke. So it is as a result of ischemia, a blood clot, okay, that is also causing this type of stroke. But it kind of resolve its own within a few minutes to hours. Okay, after a few minutes to hours, you see that it will resolve. One important thing you should always have in mind is that always evaluate and treat the essential reason causing the TIA so that it doesn't aggravate to what? Ischemic stroke. Because once you get a TIA, the probability of it developing to ischemic stroke is very high. So when you have TIA, always make sure that you are being evaluated and treated so that it doesn't cause, if it's about taking medication to dissolve that small clot that caused it, you need to have it so that it doesn't aggravate to ischemic stroke. So these are basically the type of stroke that we have. We have the ischemic stroke, which is caused as a result of a blood clot, hemorrhagic stroke, which resolve when there is a bleeding within the brain, okay? And this bleeding is caused by a rupture or a trauma to the blood vessels. We have TIA, which happens as a full stroke, but it is temporal. Okay, you have all the signs of stroke, but you see that after a few minutes or hours, it will be resolved. Even at times, by the time the ambulance or help comes, it has been resolved. But make sure that you are being evaluated and treated to prevent any further ischemic stroke forming. Okay, so these are the types of stroke that we have. Don't forget that we have the carotid and the vertebral artery that is supplying the brain with the needed amount of blood. So if these arteries are compromised, whether through clot or through rupture, and these brain cells are not getting the oxygenated blood, and eventually when these cells die, it leads to what we call stroke. Okay, let's continue. Okay, so when you have stroke, we know that our brain have different functions. We have various parts of the brain, okay? And these carotid and these vertebral artery that we are talking about, they have different places that they supply the needed amount of blood. Because let's take, for instance, the carotid artery. You and I know that our carotid arteries supply the frontal part of the brain, the frontal part, the parietal part, and the temporal lobes with blood supply. And the vertebral artery rather supply the brainstem, the cerebellum, and the occipital lobe. So eventually when there is a problem with the carotid, it means that that particular place that is supplying that blood is going to be defect. Same as the vertebral artery. If I'm having a defect in my vertebral artery, it means that I'm going to have a problem with my brainstem, my cerebellum, and my occipital lobe. Okay, both the left and the right side. Okay, so just know the various functions, or the various parts of the brain and their functions. Okay, so let's see blood supply to the brain. It is importance of blood supply for the brain. Brain mainly receive blood from the carotid artery and the vertebral artery. That one we all know that our brain is being supplied with blood from the carotid and the vertebral arteries. I've told you that the carotid arteries provide both the left and the right side of the brain with blood, but mainly they provide blood to the frontal part of the brain, the frontal part, the parietal, the temporal lobe, okay? And also with the vertebral artery, they mostly provide blood.
Instead of insured. I want for no sooner was starting.
I want to have this as a card.
Please, can we mute? Okay, and the vertebral artery provides the brainstem, your cerebellum, and the occipital lobes with the needed amount of blood. But let's not forget that we have the brain anatomy. Before you understand CVA very well, you need to understand the various brain anatomy, the various parts of the brain and their functions. I always say that I always don't want my students to think, oh, what is the function of this? Just imagine that this is your brain. Okay, this is your brain. The frontal lobe, the front of your face. Okay, you, at least right now that you are sitting there, you can touch your front. Okay, when you are trying to think, you touch your forehead. So the frontal lobe basically is for thinking, is for speaking, is for memory, and is for movement. If I want to move, my movement is being determined by my frontal lobe. When we talk about the temporal lobe, look at where your temporal lobe is. Where is it located? It is located right behind the ear. And see, even if you are going to forget anything about temporal lobe, you shouldn't forget about the fact that our temporal lobe is closer to the ear, and therefore it is responsible for your hearing and your learning. If I'm learning, it should go through my ear. I need to understand whatever I'm learning. And therefore, my temporal lobe is responsible for my hearing, my learning, and even my feeling. For somebody to tell you about his feeling, you need to listen to what the person is saying. So it goes through your ear. So I always say that the temporal lobe is closer to the ear and is responsible for your hearing, your learning, and your feeling. Our occipital lobe is at the back of our forehead. This one, we all know that in our African adage, somebody will say when somebody hits the back of your head, is going to affect your eye. So it should give you that perception that your occipital lobe is responsible for your vision, and I'm able to perceive or see colors through this vision. And therefore, the occipital lobe is for vision as well as color perception. So my occipital lobe is for vision as well as color perception. Let's look at the other one too, which is the parietal lobe. When you want to be very good at these brain parts, just know that the parietal lobe, if your parents or even if somebody wants to knock you, they knock you through your parietal lobe. They knock on your parietal lobe. So basically, it is for touch. So if I'm knocking you, I'm touching your forehead, I'm touching your brain, and which part of the brain? That is the parietal lobe. So that it will be easy for you to know that, okay, my parietal lobe is for touch. Because if I want to knock my child, my brother or my sister, I knock them through what? Their parietal lobe. And that is responsible for touch as well as language. Why do we knock our children? Because you want to what? Signal them to do something. And that is a form of what? Language. And therefore, my parietal lobe is for what? Language as well as touch. So we've talked about the frontal lobe. I always say that, oh dear, even if you are going to forget everything, just remember these simple things. My frontal lobe is in front of my head. If you want to think, you touch the front of your head. So the frontal lobe is basically for thinking, for speaking, for memory, and for movement. My temporal lobe is closer to my ear and is for what? Hearing, for learning, and for feeling. My parietal lobe, that is where it's responsible for touch. If somebody touch me and I'm able to sense it, it's as a result of what? My parietal lobe, as well as what? Language. The back of my forehead, which is the occiput, okay, is responsible for what? Vision and color perception. That is why I'm saying that we as Africans, we always say that if somebody touches the back of my forehead, is going to affect my ear. And it's because we scientifically, it is responsible for vision. That is why people always attribute it to that. And if I'm able to say this is color blue, color red, color yellow, it's because of what? This occipital lobe. And therefore, it's responsible for vision and color perception. And the other one is what? The cerebellum, which is responsible for what? Balance and coordination. And we also have brainstem, which is responsible for the various what? Vital signs like our pulse, our temperature, our blood pressure. Okay, so these are basically um the the various brain what? Parts. Okay, the frontal lobe, the temporal lobe, the cerebellum, the occipital, the parietal, and we also have our brain stem. Just don't chew it. The little that I've told you, it will be easy for you to what? Understand which part affects. If I'm being affected by my parietal lobe, what is going to happen? If I'm being affected by my occipital lobe, it means my vision is going to be what? Affected. So just know this and it's going to what? Help you. So the frontal lobe, which is color-coded red, just like we are seeing on the screen, is responsible for thinking, speaking, memory, and movement. Our parietal lobe, which is the blue, and I've made you understand that you as parents, when you want to knock your child, you knock them through what? You knock them on the head, and it's mostly at the parietal lobe where we knock. And just know that when I'm knocking my child, I'm knocking my child because I want to what? Signal him or her something. So I'm trying to speak to him. So it affects what? It's responsible for language and also touch. Our temporal lobe, which is closer to the ear, is responsible for hearing, learning, and processing feelings. And then the occipital, which is at the back, is responsible for vision and color perception. We have our cerebellum, which is responsible for what? Our balance and coordination. This one we all know through nursing school. And the last one is what? The brain stem. And the brain stem is responsible for what? Our vital what? Life functioning, like our breathing, our heart rate, and our temperature. They are being regulated by what? The brain stem. In as much as we are talking about these parts, let's not forget that the brain, we have the right hemisphere and the hemispheric function, which is the left part and the right part of the brain. Okay, so basically, this is what they are trying to talk about. So, this is the left and the right side. So, the brain has two hemispheres, the right side and the left side. Okay, so if you're able to know what goes into the left side and what goes into the right side. If your patient is having stroke, it's easy for you to also what identify what is happening to your patient or what's functioning will be what affected. So in simple terms, our left side of the brain, which is L, is responsible for what? Our logical reasoning. Our logical what reason, like speaking, writing, reading, math skills, analysis, info, and planning. Left is for logical, right is for what? Creativity. So if my right part is affected, I'm going to have issues with what? Creativity. So if my left side is also affected, then I'm going to have issues with what? Logical reasoning. So they said the right side is responsible for what? Attention span, showing emotions, okay? Ability to solve everyday problems by making decisions, your reasoning, okay? Understanding jokes, reading in between lines, making judgmental calls, memory recall, music or art awareness, controlling the left side of the heart. We all know that the brain is contralateral. So if I'm having problem with my right side of the brain, which is the right hemisphere, it's going to affect my left part of the body. The same way, if I have problem with my left side of the brain, it is going to affect my right side of the body. So let's go back to our notes. So with the right hemisphere, just like I said, is responsible for creativity. So if I'm having issues with my right side, it is responsible for creativity, attention span, emotion expression, quick decision making, problem solving and reasoning, judgments calls, memory recall, music and awareness, control of the left side of the body. And the left side of the hemisphere, which the L, left side, is responsible for what? Logic, language, okay? So mathematics and problem analysis, and it's also responsible for planning and organizing thought process. So in the nutshell, just know that okay, my right side of my right hemisphere is responsible for creativity, whilst my left side, which is L, left represents L, logical reasoning or logic or language is also represented with what? L. So that when you know this, it will be easy for you to know in your NCLEX that if they are giving me a question and they are telling me about the right side of the right hemisphere which is affected, then I should look out for these things are going to be affected in my patient. Okay, so the right hemisphere controls your creativity, whilst the left side controls what? Your logic, reason, or your language. And don't forget that our brain is contralateral, and therefore, if I'm having issue with my right hemisphere, it is going to affect what? My left side of my body. The same way, if I'm having issues with what? My left hemisphere, it is going to affect my right side of my body. Any question up to this point? Okay, so let's see. I'm having stroke. Now, they are saying that I'm having issue with my right brain injury. I'm having right-sided problem. The problem is having issue with my right hemisphere. What is going to happen? What is going to be affected? A right brain injury affects normal functions, leading to primarily impairment on the left side of the body due to the brain's contralateral control, which I've already explained to you that our brain, okay, hemisphere, okay, is contralateral, okay, to the body. So if I'm having issue with my right side of the brain, it is going to affect my left body functioning. So if you see somebody with, let's say, right-sided weakness, it should appear to you that this person is having issues with what? The left side of what? The brain or the left hemisphere. So what is going to be affected? I will have left side hemiplegia. Patients experience weakness on the left side because the right brain is affected. Okay, there is impairment of creativity. I told you that the right side what controls or is responsible for what? Creativity. And therefore, if I'm having a right brain injury, okay, or I'm having a right hemisphere problem, I'm going to have issues with what? My left side. And I'm going to have the right brain is associated with creativity. Patients might have difficulty with understanding and interpreting art and music. So I'm going to have issues with creativity. There is going to be problem with temporal and spatial confusion. Patients will struggle with confusion with date, time, and places. So if the right side is affected, you see that this patient is going to have issues with what? Your date. And if you tell her what is the date or the time, or is it morning or evening, they can't even tell you. There's going to have loss of depth perception. Patients may have difficulty judging distances and spatial arrangements. Okay, they will have communication difficulty. They are going to neglect the left side of the body. Okay, so a significant issue is left-sided neglect, because now I'm having issues with my right side. My left side is not working, so they intend to what? Neglect that side. They don't try to use the left side because it will be weak, it will be affected, and they will try to what? Neglect the left side. They will have grooming issues, okay, because they are no more creative. Even if you give the patient a comb, he doesn't even know how to what? Use it, okay. Patients might struggle to maintain proper grooming habits due to neglect and cognitive what? Effect. Okay, they've forgotten the creativity of even using with some grooming equipment. Emotional instability. Patient can display emotional volatility, impulsivity, poor decision ability, and inadequate assessment of spatial elements such as shapes. Okay, so they will be having poor judgment. They don't have insight about so many things. Okay, they have denial of limitation. There is lack of awareness regarding their limitation. They don't have insights to what is happening to them. Okay, heightening the risk of injury due to impulsivity. So people with right-sided injury or right hemisphere problem, they have what? Denial of limitation. They don't have awareness towards their problem. They lack awareness to their limitation, so they are at risk of falls. You need to be very careful. They are at risk of injuries. Okay, nonverbal language interpretation. They have difficulty in interpreting nonverbal cues and understanding hidden meaning in communication. Okay, so they have limited interpretation to nonverbal language. Okay, attention span. Patients exhibit a notable short attention span, impacting education and instruction effectiveness. So even when you tell the person to do something, they are not able to what? Even understand what you are trying to what? To say. They are not able to pay attention or attentive to what you are telling them. Okay, so that is with what? The right brain injury or the right-sided what? Hemisphere. Let's see the left side where there is problem with what? Logical, language, and the rest. What is going to happen? What effect are they going to see? A left brain injury primarily impacts the right side of the body as it represents contralateral effects, just like we've explained. Okay, there'll be right-sided what? Hemiplegia. Patients will experience weakness on the right side because the left side of the brain is what? Affected. We said people with left-sided problem, they have logical problem, they have language barrier. So people with left brain injury, they have problem with what we call aphasia. They have difficulty in formulating and comprehending words. So these aphasia, we have two different types. We have the expressive aphasia and then the receptive aphasia. When we say expressive aphasia, it is normally found in the Broca part of the brain, and the receptive is the Winnick part of the brain. So when we say expressive, expression, receptive, receiving something. So people with expressive aphasia, they have trouble producing what? Speech, despite understanding your language fairly well. So expressive aphasia, I have problem, okay, producing speech. I'm not able to express myself well. So the words even explain itself. So because people with left-sided injury, they have language problem, they have logic issue, they have what we call aphasias. And I've explained to you that with aphasia, we have expressive aphasia or what we call the Broca aphasia. And we have the receptive aphasia, which is the Wernicke's aphasia, and it is normally due to where the injury is coming from. Okay, we have the Broca part of the brain and the Winnick's part of the brain. Okay, so with the expressive, just like I told you, the words explain itself. I have trouble producing speech. You see that my speech will be very bad. Okay, despite even me understanding what you are telling me fairly well. Okay, I'm unable to produce speech very well. Let's say I'm telling you I want water. Because I have expressive aphasia, I would say it will take a very long time for me to even produce want. Okay, so I have trouble producing speech. I'm able to make a little bit of speech, but it is very difficult. Receptive, receiving. So you have difficulty understanding spoken words. So expressive, they can understand fairly well to some extent, but they have trouble producing the speech. Receptive aphasia, they have difficulty understanding spoken or written language, while their speech remains fluent, even though it is meaningless. Though I might be saying something which does not make sense, you will see a stroke person saying something like word salad. Whatever he's saying does not even add up, but he's able to talk because he understands what you are saying, but he does not understand what you are saying, but he's able to produce words. So that's the difference. With the expressive, they are able to understand fairly well, but they have trouble producing the speech. With the receptive, that is receiving. So those ones too, they have issues receiving or understanding what you are telling them, but they are able to produce speech, just that their speech are normally nonsensical or meaningless. Okay, so let's go to the other effect. We have awareness of limitless. Unlike patients with right-sided, if you remember, I told you people with right-sided brain injury, okay, if the problem is coming from the right hemisphere, they have limitation to their awareness, okay. But these people, they are aware of their limitations, okay. Unlike the right-sided, where they are at risk of injuries, risk of falls, people with the left brain injury, they have awareness of limitation. Okay, so unlike patients with right brain injury, these patients are typically aware of their limitation. They are aware of what is happening to them, okay, leading to potential psychological impact. Imagine you know what is happening to you. You know that you have a stroke, it is affecting your speech, so they become very emotional. So you see people with stroke, some of them are very tearful, they cry of everything. It's because they have awareness of what is happening to them. Okay, so they become very emotional. They know that if they are they are at risk of injuries, they are at risk of even swallowing difficulties. Their right side is not working. They are limited. Somebody who had full capacity going back and forth, now he's not able to mobilize very well. Her right side is very weak because they have awareness to what is happening to them. They have potential psychological impacts. So they are mostly tearful, they get easily anxious. Okay, and they have emotional consequences. Okay, patient may experience severe depression, anger, frustration as a result of their awareness of their disability. Okay, and they have challenges with written language and numbers. We've already said that they have problem with language, speech, and logic. Okay, so difficulty in understanding written text and interpreting numbers, often interest in math skills difficulties, and they have agrasia, which is issues with writing ability. Okay. Intact memory. Memory capacities may remain intact despite other cognitive impairments. Okay. Though they might be having other cognitive impairments, but their memory is to some extent intact. That is why you will see two stroke persons. One of them does not even understand anything. Whatever you say, he cannot even make a meaning out of it. But one of them may have the impairment, all these weaknesses, they cannot even write, but they have mental capacity, they and memory capacity, they even understand what is happening to them. That is why we said people with left hemisphere problem, they have insights to their problem. They have memory capacity. They understand what is going on, what is happening to them. Okay. And people with left-sided brain injury, they have what we call the visual impairment. That is why we say people with stroke, they have heminopia. Patients may have issues seeing objects on the right side of the body. So when they have because of the left brain injury, they will be having right heminopia. So that you see that they will be, you put a food on their plate, they will only be seeing the left side but not the right side. So you have to always make sure that they turn their head 360 degrees on the plate when they are eating, because it's not intentional. You see that they'll be eating just one part of the food because they are not able to see the other part of the plate. Okay, so you need to make sure that their eyes go 360 or the plates go 360 so that they'll be able to see what is presented to them. So if you understand this, it will be very easy for you to do any stroke question. Know the various parts of the brain, know which one is affected. When it comes to left side, we say we have issues with language and logic. When it comes to right side, injury, they don't have awareness to their problem. So those people, they are not normally emotional, but they are at risk of injury. Any question, guys, before we continue? So just like we are saying stroke, some as a result of clot, some as a result of hemorrhage. What are the risk factors? Which people are at risk of stroke? We say people who smoke, because smoke harms the integrity of the blood vessels. And if the blood vessels are harmed, it leads to reduced functionability, which increases the likelihood of stroke, because these can destroy the blood vessels. Okay, people on blood thinners. Okay, when if you are taking blood thinners, your risk of blood vessels rupture is increase, because if you have aneurysm and you are taking blood thinner, the probability of this aneurysm rupturing is also very high. Rhythm changes. I told you, if you have atrial fibrillation, AFib, if you've done ECG in your various classes, AFib and A-flutter, you are at risk of developing blood clot, because there is pooling of blood within the atrium. Okay, because the atrial quivers, it increases the blood pooling at that area, and these result in formation of blood clot, and these clots can dislodge to these blood vessels supplying the brain with oxygen, and this can lead to stroke. So rhythm changes like atrial fibrillation and atrial flutter can increase your risk of developing stroke. Oral contraceptives, okay, and then family history, excessive weight, people who are obese, they are associated with hyperlipidemia, and these can increase your risk of stroke. Older individuals, okay, as you age, your blood vessels loses its elasticity, they become less resilient, and it increases your risk of stroke. Hypertension, uncontrolled high blood pressure, okay, it's a significant risk factor for stroke, especially when it comes to these both the hemorrhagic and the ischemic stroke. So uncontrolled hypertension is a very significant risk factor for stroke. Atherosclerosis, when there is buildup of plaque in the arteries, which can obstruct the blood flow, it leads to stroke. Physical activity, people who live sedentary lifestyle, no exercise, their work demand them to sit at one place, it increases your risk of stroke. Previous TIA. I told you, when you have TIA and you don't solve what caused it, your risk of developing a stroke is also high. So TIA is often termed as a mini stroke because it's resolved within minutes to hours. So if you have TIA and you don't solve it, you can experience, or it can lead to developing a subsequent stroke. Okay, so seeking for medical evaluation is very important following a TIA. Elevated blood glucose. People with diabetes, okay, these high sugars damages your blood vessels over time, increases your risk of stroke. That is why, if you've noticed, mostly people with hypertension and stroke, they are those who normally develop this stroke. They are the most increased risk, or the number 2 risk factors that what causes stroke. Aneurysm, especially in brain aneurysm. So if you have these vessels outpouching, okay, these outpouching of the blood vessels, when it bursts or it ruptures, it can lead to hemorrhagic stroke, because the bleeding is going to go through the brain, where it will deprive the brain stem of the needed amount of oxygen. So aneurysm is also a risk factor. We've talked about various signs and symptoms. If you notice, we've talked about the fact that the left side, what effect is going to happen, the right side. Let's look at how would you recognize a patient having stroke. If you are there with your patient, how will you know that my patient is developing stroke? So we have something we call act fast. If a patient is developing stroke, you need to act fast. And the fast here means that the F is for the facial. You will notice that there is a facial drooping, okay, uneven smile on the person's face. So if the NCLEX, you see a question, an NGN, a case study, and they tell you that your patient is there, you are there with your patient, and then after some time you realize that their face is drooping. There is an uneven smile, which represent the face, the F, the A, which represent the arm. There is arm weakness, okay? When you tell the person to raise one arm, they are unable to, okay, or they are even unsure. It is a warning sign. You are there with the patient, all of a sudden you see that the face is dropping. The arm, when you tell the patient that the arm is getting weak, you tell the patient to raise the arm, he or she is unable to. Their speech is not very good. It is sledged. It should tell you that the patient is developing stroke and you need to act fast. So in the NCLEX, they will give you a scenario, or you will see a scenario where you were with a patient at this time, and then all of a sudden the face started dropping. You see an uneven smile. The arm, one side of the arm is not very good. When you tell the patient to raise it, he or she is unable to. Their speech is not very good. Somebody you were talking to in a few minutes ago, then you need to act fast. And the T is the time. Why is time very important with somebody developing stroke? Let's see. The T is very important because the time the symptoms started happening, it is going to allow you to know if the patient is going to respond effectively with treatment. So how will you recognize stroke? Don't forget the mnemonic act fast. The act fast means you, as a person who was there during your NCLEX, you need to act fast. And the F should let you know that F is for the facial, the A is for the arm, the S is for what? For the speech. The patient will have sledge speech. And the T is the time you started seeing the signs and symptoms. Are we okay? Are we okay? Or any more question up to this part?
Yes, we are okay. Miss Love, can I do a small ad?
Yeah, please.
All right, so guys, welcome to NCLEX Pro Solutions. We are a group of nurses who have come together to make sure that nurses who are willing to ace the NCLEX do so without any stress. And once in a while, we come up here and do a free Zoom session for all of us to refresh our mind on whatever we studied in school. And it's also a reminder to tell you that the NCLEX is doable when you are committed. So some of our services include registering you for the NCLEX. And as you've been seeing our videos mostly on TikTok, we assist diploma nurses and specialty nurses with degree midwives, degree public health nurses, and degree mental health nurses. So if you need our services, just send us a DM and we will assist you. We just charge only 1,500. We will do all the registration for you. And our tuition is only $180 for 4 months. And I've seen a lot of people here and I'm happy. I've seen my classmate here. Nabade, welcome. Guys, let's enjoy. I'll come back later.
Okay. So how would you recognize a patient who is having stroke? That was where we reached. That is why I said we have a mnemonic, act fast. So in the NCLEX, if you see that, okay, in the question, they said the patient is having, you were with somebody and all of a sudden the face is drooping, there is an uneven smile, or the face is asymmetry. One who say in style, the arms are not very good. Okay, all of a sudden the arms are what, weak. If you tell the patient to raise both arms, one of them will drift down. It is a warning sign. And then speech, you need to also evaluate how is the speech. Within some minutes, the patient is not able to what, talk. While you were talking to her, all of a sudden the speech is slurred, it's unclear. It is a potential notice to you that you need to what, act fast, because the patient is what, developing stroke. And the time is very important, because I told you we have two type of stroke, three. Apart from the TIA, let's look at the ischemic and the hemorrhagic. If you are able to notice the time the stroke happened and the time the patient went into the hospital, and it is within 3 to 4.5 hours, there is something we can give, what we call the tissue plasmogen activator, which is going to, let's say, dissolve. If it's for clot, let's say it was a ischemic stroke, which is as a result of clot, and you go and then they tell you that, okay, the patient had the symptoms 2 hours ago, then something can be done about the clot. The clot can be dissolved by giving a TPA, tissue plasmogen activator. And this can only be given within a window period of what? 3 to 4.5 hours. That is why they always want to ask you about the time you saw the signs and symptoms. So in your NCLEX, you need to check the time the patient started exhibiting the signs and symptoms. If it is more than 3 to 4.5 hours, then we can't give this TPA, because you can only give this TPA within 3 to 4.5 hours to dissolve that blood clot. Okay, so that is why the T is very important. That is the time the patient started exhibiting the signs and symptoms. And let's not forget that before they ask you the time, okay, they will ask you the time. It is within 3 to 4 hours, but they need to do a CT scan to know which type of stroke the patient is suffering from. Because imagine a patient is having hemorrhagic stroke, and then in your NCLEX, a CT scan it's not done, or you did not even check whether a CT scan was done, and you gave a TPA and the patient was having a hemorrhagic stroke, you are rather going to cause more harm than good, because this TPA is going to what, cause more further bleeding. That is why you need to do a CT scan to identify the type of stroke, and therefore if it's a ischemic stroke, that is when you can give the TPA. So in normal terms, what I'm trying to say is, if you see the signs and symptoms, you've able to notice the time it happened. Let's say it's less than 3 hours. Let's say an hour ago that the patient started exhibiting the signs and symptoms, and then they've done a CT and they notice that it is ischemic stroke, then they can give the TPA to go and dissolve the clot that is blocking the artery. But if it's hemorrhagic stroke, you can't give TPA, because it's rather going to cause more harm than what good, because the patient is going to what, further what, bleed. Please, do we understand what I'm trying to say? Are we okay?
I think we are.
Yes, yes.
Okay. So before you can give the TPA, just note that you need to ensure the time the signs and symptoms happen, and there should be a CT scan to what, confirm that it was what, an ischemic stroke, before you can give what, the TPA. So let's look at some of the indications. There are some indications where you can give the TPA and when you cannot give the TPA. So let's look. Manuel, can you give me a minute? Can you talk? I'm looking for my slide. I think they are messed up.
Okay, all right. So, guys, let me remind you that if you are a midwife, because I have a lot of midwives in my DM right now, if you are a midwife, we can assist you. You can go through the process, but we always want to assist BSc midwives at the moment. And if you are a midwife and you are in school, probably you have a diploma and you are on your way getting your BSc too, you can also link up as well. And most of the frequently asked questions are on our socials. We have a YouTube channel, our TikTok channel as well is very active, and we are even
Thank you, Manuel. Thank you.
CCA. Okay, Mati Tuaso.
Okay. So just like I was saying, you've been able to know the act fast. In the NCLEX, they've given you a question and you saw the face drooping, the arm drifting, the slurred speech, and you've been and then you've been able to identify that, oh, my patient is developing stroke, or this condition that they are trying to ask me is stroke. And they've done a CT. So initial diagnosis strategies is to do a CT scan. And this CT scan is going to rule out hemorrhagic stroke. Because if it's hemorrhagic stroke, you can't give TPA, okay? It's essential as patients with bleeding cannot receive the TPA. So if you do the act fast, and then in the NCLEX, they will tell you, you see it in the NCLEX that they will tell you that a CT was done and is ruled out that your patient is having what? Ischemic stroke. That is when, okay, my patient is having ischemic stroke. Then what is the next thing I have to do? I need to check when did the symptoms happen? If it's within 3 to 4.5 hours, then we can give what we call the tissue plasmogen activator. So you need to ensure that a CT scan was done and we've been able to rule out hemorrhagic stroke. Then we can say that, okay, now our patient is diagnosed of ischemic stroke. It is clot forming. Then we can give what? The TPA to dissolve the blood clot to help with what? The stroke. So TPA is a clot dissolving medication used specifically for ischemic stroke, not hemorrhagic. Because if you know your content, it should let you know that hemorrhagic stroke, there is bleeding that is ongoing. And if I'm going to give a medication that is going to cause bleeding, then I'm going to cause more harm than good. Therefore, TPA is only given for patients with what? Ischemic stroke. So TPA is a clot dissolving medication used specifically for ischemic stroke. So the TPA activates a protein that promotes fibrinolysis. What you have to know is that it is going to break down the clot and restore the blood flow to the brain tissue in need. That is why the time is very important. The time is very important because the TPA is going to what? Break down the clot and restore blood flow back into the brain cells. So TPA must be administered within 3 to 4.5 hours. Other books will tell you 3 hours. Others book will tell you 3 to 4.5 hours. From the onset of the symptoms to maximize effectiveness. After 4.5, you cannot give the medication. There are exceptions for some patients if they meet the criteria. So in the NCLEX, when you are looking at the questions, you need to make sure that all these things your patients are not having it. 1, the systolic blood pressure must be less than 185 millimeter per mercury. If the in the NCLEX, so they will always try to trick you that the patient has a CVA. Initially, when he came, the blood pressure was 200. In Tubos Afede, as time goes on, sorry for speaking my language, as time goes on, you see that they will say that antihypertensives are given and now the blood pressure has reduced. So before you can give a TPA, the blood pressure, the systolic blood pressure must be less than 185. If the systolic blood pressure is more than 200, that patient, you can't give her TPA. And the diastolic pressure must be less than 110. Apart from this, there are some things that the NCLEX will also trick you. I'm telling you that before you can give TPA, the blood pressure shouldn't be more than 200 over 110, or it shouldn't be more than 185 over 110. They will give you a scenario where the blood pressure is 100 over 70 or 100 over, let's say, 60. That one too, you can't give because there is no enough perfusion to the brain. The blood pressure is low. You can't, will be low, or it will even be lower after you give the TPA. So that one too, you can't give the TPA. So you will see a question where they will give you blood pressure range. Always go for the ones that the blood pressure is within a normal rate. It might be high, but not as high as 185, and it shouldn't be as low as 110. So the blood pressure is very important when giving TPA. Okay. And also, you shouldn't give TPA to patients who is receiving heparin. So that is where the NCLEX will trick you that a patient is taking heparin or warfarin, or a patient has been weaned off warfarin 2 weeks ago. If that patient had heparin 2 weeks ago, you can give that medication TPA. But if that very day the patient has had warfarin, heparin, is not a candidate for TPA. Take note. Contraindications for TPA. I'm telling you that if the blood pressure is high as 200 over 110, that candidate, you can't give TPA unless you give antihypertensive to lower the blood pressure before you can give TPA. If the patient has received anticoagulants, heparin or warfarin, you don't give this medication, recent medication use. But in some question, they will tell you they had the anticoagulant 1 week or 2 weeks ago. You can give the medication because the TPM, the warfarin duration or action in the blood is mostly 2 to 5 days. After 5 days and the medication was stopped a week ago, you can give TPA. But if in the question they tell you the patient had recent heparin like 2 days ago, you can't give TPA. So take note. If the blood pressure is high, if they've had recent anticoagulants like heparin or warfarin use, you can't give TPA. If they've had suspected subarachnoid hemorrhage, you can't give TPA. Or if there is any evidence of intracranial hemorrhage, you can't give TPA. So that is why NCLEX will give you a scenario that, okay, the INR, that is why I always say that the NCLEX will not give you a direct way for you to think quick for you to answer the question. They will give you an indication where the patient had the patient that you are going to give the TPA, she's had an accident and like he hit the head on the floor and exhibiting some signs and symptoms of intracranial pressure. So they will give you the Cushing's triad. They won't give you directly that the patient is having increased intracranial pressure. They will give you signs of increased intracranial pressure. They will give you an instance where the INR is very high. That will tell you that the patient might be taking an anticoagulant. That is why the INR is high. So you need to always think fast, because the question is not going to give you straight ahead that your patient is having subarachnoid hemorrhage, the patient is having evidence of intracranial. That one will be very easier for you to choose. They will give you examples that will tell you that your patient is having subarachnoid hemorrhage, an example that will indicate to you that the patient is having evidence of increased intracranial pressure, and evidence that the blood pressure is high, and evidence that the patient has had a recent anticoagulant. These people are not candidates for TP. So you need to also be very careful when you are answering your questions. Okay. And then even when they said the blood pressure is also as high as 180, you need to ensure that the blood glucose is also very low. Okay. So before you give TPA, these are what you need to make sure. You need to make sure that a CT has ruled out hemorrhagic stroke and is an indication of ischemic stroke. That is when we can give TPA. We can only give TPA when from the time the patient had the symptoms to the time you are going to give the TPA is within 3 to 4.5 hours. 3 to 4.5 hours. That is when you can give the medication. If it is more than 4.5 hours, you can't give the TPA. There are criteria that I've told you. If your patient has suspected subarachnoid hemorrhage, you can't give the TPA. If they have evidence of increased intracranial pressure, that is what I'm telling you, they won't give you a definitive word that your patient is having subarachnoid hemorrhage, but they will give you something like the patient has hit the head after the trauma and is bleed, anything to let you know that the patient is having subarachnoid hemorrhage. An indication for increased intracranial pressure, like your Cushing's triad, okay, to let you know that the patient is having what? Increased intracranial pressure. If the INR is more than the 2 to 3, if they give you an INR of, let's say, 5, 6, it should let you know that the patient might have had a recent anticoagulant use, and therefore you can't give a TPA because the patient can bleed. Okay. So these are some of the signs and symptoms of stroke. And these are signs of neurological signs and symptoms of stroke. The patient will have dysarthria, a condition where the patient is unable to speak clearly due to the weak muscles. Okay, so results in slurred speech as reference to the mnemonic fast. Because of the slurred speech, they will have dysarthria. Please don't laugh at me. Okay, I'm very bad with pronunciation. And then aprasia, a patient with stroke will also have inability to perform voluntary movement, okay, despite normal muscle functions. So, example, the patient will have difficulty performing movements like winking or reaching to scratch their back. Okay, they will have agrasia. When we say agraphia, it's just loss of inability to write. Just like I told you, they will have difficulty with written languages, okay, because of the impact they have with they are cognitive. They will have alexia, inability to read, or loss of the ability to read, okay. They'll have agnosia, the inability to recognize or understand sensation or known objects or people. You see that people that they used to know, they don't even remember them again. Okay, so a patient shown a pencil might fail to identify it or call it by another name altogether, indicating a disconnect between perception and understanding. They will have dysphagia. So if they have difficulty swallowing, it means that they are at risk of aspiration. They are at risk of choking. Therefore, if they are at risk of aspiration, it can lead to a pneumonia. Okay, so you need to monitor this patient during feeding. You need to very careful when it comes to feeding such patients. And they have what we call the hemianopia. That is limited vision. I've already explained to you. You see that they will only see one side of they are only able to visualize one side of the visual field. So if you place something or an object in their view, they will only be able to see one side. That is why when a patient is having stroke and you give them food and you identify that they are having this heminopia, you need to ensure that you rotate the plate 360 degrees so that they'll be able to see whatever is on the plate to eat them. Okay, so these are just some normal signs and symptoms of stroke. Let's look at our nursing intervention, which is very important. They might ask you, what are you supposed to do when caring for a patient who received TPA, a critical medication of stroke treatment? Nurses must perform several interventions to ensure patient safety and recovery. Because you are going to dissolve a major clot, which has occluded the blood vessels, you need to ensure and look out for signs of bleeding, okay? Because they are at increased risk of bleeding. That is why if any patient is having issues with bleeding, you need to be very careful not to give TPA. Please, you might go and see a question where they are talking about a lady menstruating. That one is not part, okay? But you see the major hemorrhage, right? Increase in intracranial pressure where there is bleeding into the brain cells, you don't need to give this TPA. Therefore, after you've given TPA, let's say the patient is a candidate for TPA, you've already given, you need to monitor for bleeding risk, okay, or signs of bleeding. All right. And then our general nursing management is always monitor the blood pressure, the vital signs. Okay, you need to always monitor for the blood pressure. Look out for signs of elevated blood pressure. Look out for decreased heart rate or respiration. look out for signs of altered level of consciousness, because if they are having hemorrhagic stroke, we said they are going to bleed into their brain, which is going to cause increase in intracranial pressure. Therefore, you need to look out for what? Altered level of consciousness, nausea and vomiting, okay, unequal pupils response, okay. So you need to always ensure that your vital signs are always monitored to look out for any changes. Always look out for the airway and aspiration risk. I've told you these patients have dysphagia, okay. So always ensure that they always know that they are at risk of potential swallowing difficulties, especially post-stroke. Therefore, you need to ensure to give them taking fluid, puri diet. So they might ask you in the NCLEX, a patient who has stroke, or you have an NG and a case study on stroke. You see that at the end of the question, they'll be asking you which of the following are recommended foods that you need to give to patients with stroke. You need to give puri diet, taking fluids. Okay, and then oral secretions may accumulate, which will lead to risk of aspiration. Therefore, you need to ensure that they don't hoard food in their mouth. Clean their mouth, oral care daily, okay, and ensure suctioning equipment is always readily available, okay, because of their risk of aspiration. And then you need to always assess their cranial nerves using the cranial nerve cranial nerve 10 and cranial nerve 9, the glossopharyngeal and the vagus nerve. Okay, you need to test the ability to swallow and the gag reflex. With the gag reflex, you use the cranial nerve 9, which is the glossopharyngeal, and with the cranial nerve 10, which is the vagus nerve, that is able to help you test the ability to swallow. You need to assess all these things, and you might go and meet it. Which of these following cranial nerve are responsible for swallowing and gag reflex? Don't forget your 9 and 10, glossopharyngeal and your vagus nerve. You need to assess their bladder and bowel function, offer bedpan and bedside commode if they are unable to use the toilet. Mostly, some of them become incontinent, and if they are continent, you need to, even if they are incontinent, you can offer them bedpan, and always make sure that they are always changed regularly when they are incontinent, okay. Utilize a Foley catheter when necessary to always monitor the intake and output, okay. And then you need to their skin integrity. These people are having paralysis. They are unable to move from side to side. What is your nursing intervention? You need to reposition them every 2 hours to prevent developing pressure sore. And then you need to perform passive range of motion exercises, okay, to reduce their stiffness and also help improve their mobility. We said they tend to neglect, they have a neglect syndrome, and then due to the hemianopsia, they have a neglect syndrome. They are unable to look, because of their paralysis, they have neglect syndrome, and they have hemianopsia, so they tend to neglect some part of they are unable to see some side of the things that are being presented to them. So what are you supposed to do? Often seen in patients with right-sided brain injury, okay, leading to left-sided neglect. Patient may ignore or fail to use the affected side. They may fail to use the side that is affected. You remind the patient to always use it, okay. When you are giving them food, you try to tell them to use the affected side to feed, okay. Encourage environmental scanning to prevent injury. You tell them to look through their environment, because we realize that with these right-sided brain injury, because the left-sided is affected, they don't have insight, they don't have awareness. So you always tell them to scan their environment, okay, to prevent risk of injuries. And with the hemianopsia, you also make sure that you show object to them. So if it's food, you turn the whole food 360 for them to see it very well. Okay, you train patients to scan their environment to compensate for visual deficits, because they are unable to see one side of the things that are being provided to them. Okay, so patients who have swallowing difficulties necessitating a swallow study by speech therapist. So you can refer them to speech and language therapists to come and assess their swallowing and their speech. Okay, you give them thickened liquid, just thickened liquids. That is when NCLEX would trick you and tell you a patient that you are giving mashed potato, which of the following would make it more thicker? Milk does not make foods thicker. Okay, you need to ensure thickened fluids are being used. Okay, mechanical soft diet for easier consumption. Instead of giving normal level 7 food, you ensure that you give them level 6, level 5, depending on how easy they are able to chew. So give them what soft diets, not hard diet. Battered fish with fish and chips, these are level 7 food. You can't give them soft options. Okay, pureed meat, soft beef sauce, okay, with mashed potato. So you also offer assistance. Nurses must supervise patients to prevent pouching the food in their cheek, holding the food in their cheek. You need to assist them. When you are assisting them, you encourage them to be swallowing the food, okay, particularly on the affected side. So you always make sure that you put the food in the unaffected side to prevent them from what? Holding the food in the affected side, and also to what? Avoid aspiration. You tuck the chin. I always say that you tilt the head a little forward and then you tuck the chin downwards, okay, to prevent what? Aspiration. You tuck the chin downwards, not upwards, because if you tuck the chin upwards, you increase the risk of aspiration. Therefore, you elevate the head slightly up and then you tuck the chin downwards to prevent what? Swallowing difficult and prevent what? Aspiration. We've talked about the receptive aphasia and then expressive aphasia. How can you help these people? People with receptive aphasia, because they are unable to what? Comprehend with what you are saying. What you are telling them, they can't comprehend. You need to use short and very clear phrases. Okay, limit information overload. Simple what? Information. You don't crowd them with so much information that they can't even understand what you are trying to say. Okay, you always use what? Visual aid to also what? Facilitate understanding, because they might not be able to understand, they're not able to receive what you are telling them. You can use visual aid. Okay, they said you can also collaborate with the MTDs, the multidisciplinary team, by engaging the speech and language therapist, the occupational therapist, to help with activities of what? Daily living. And be patient with them and always repeat your words. Okay, and when it comes to expressive aphasia, because these people are not able to speak, they're able to understand but they are not able to speak. What are you supposed to do? Be patient. They're able to speak, they are not able to speak very well. You need to be patient and let them speak. If I want water, if I'm having expressive aphasia, I am going to say, I give me more time to finish whatever I am trying to what? Tell you. Maybe and it will take me maybe 1 minute before I would say want. Give me time, give them time, be patient with them. Okay, and always ask them one question at a time, so that they will give you the answer in bits and they will be able to what? Express themselves. Also be direct and ask questions with simple options. Okay, you can also use communication board, and you should always involve the family in their what? In their care. So basically, this is all you need. This is all I have for you when it comes to what? The stroke. Know the type of stroke. When it comes to ischemic and hemorrhagic, what are they? With ischemic, we have embolic and thrombosis. What are some of the risk factors? Okay, you need to do your CT scan before you rule out what? The hemorrhagic, before you can say that this patient is having ischemic, therefore I can give the TPA. What are the time frame? Know your act fast, so that you'll be able to identify or recognize in your NCLEX when your patient is developing stroke. Know the time the symptoms started and the time the patient was taken to the hospital, or the time you are going to give the TPA. What are some of the exceptions on giving the TPAs? You need to know all this. Okay. So before we go, I want us to solve these few questions on CVA, and then we bring the class to an end.
Hey, in a book soon kwa holding on. Hey, the answer crying. Anyway, guys, we are still NCLEX Pro Solutions. The name has not changed. If you are willing to write NCLEX or join our tuition, you can send us a message on TikTok check any flyers, any number that you see, just send a message and we will respond. Now we have frequently asked questions in video form on our YouTube channel and on here on TikTok as well. And one key reason why you have to join our tuition is that me proud this year. What you say? And the question, she is saying a lot more information. She's giving us the content, but after every content, you also have kill banks that you have a bunch of questions. This has been paid for. The amount of access. The whole kill bank is roughly around $149. We will give it to you so that in Kayawi CVSA, you go home in the comfort of your bed. You'll be going through all of these questions to assess yourself, to know that these questions will appear in NCLEX and this is how they can trick me. What I say? This seems a lot. Don't let the presentation scare you. We want you to grasp the whole concept of the CV. We can't come here and just say yeah, chairman courses. Of course, we have to give you all the things that you need. And we know that you guys are wise and you are intelligent and you fish the best
Thank you,
content.
Manuel.
Open
So
to
everybody is welcome. Okay, when you need content, I always say that the NCLEX, you need content. It's not just about having the book in front of you. You need content to write the NCLEX. You need to know when the question is presented to you, you know the pathophysiology that surrounds that particular condition, so that you'll be able to answer each and every question, no matter how the question is being framed. And that is all about content. So you're welcome to NCLEX Pro Solution. We meet 3 times in a week: Monday, Wednesday, and Friday. And in between them, we have our question marathon where we do question and answers. You can ask any question you want. We have our teachers that are available to help you in every stage of the journey. We treat every condition throughout till you write your NCLEX. So you are welcome. So let's do these questions before we bring the class to an end. A client asks the nurse why hypertension is a risk factor for stroke. How should the nurse respond? 1, hypertension can cause the right ventricles of the heart to enlarge. 2, hypertension is a primary cause of renal failure. 3, hypertension may mimic stroke symptoms due to retinal hemorrhage. 4, hypertension can cause emboli to migrate to the brain. So what do you think? Now you've heard about it. What will high blood pressure cause? High blood pressure, if the pressure is so high, what is it going to cause? And how does that exhibit a risk of what? Stroke. So we can put our answers in the chat box, guys. Well done. Well done, Comfort. Well done, Cosby, Nuruddin. Well done. Okay, we all know that it's so easy. Emboli, when there is an emboli in any part of the body and I'm having hypertension, blood pressure, this pressure can what? Cause these emboli or these clots to go into what? Into the brain. Well done, guys. Persistent hypertension can cause emboli or thrombi from the blood vessels to migrate to the brain, resulting in ischemic stroke. Hypertension may lead to an increased risk of an aneurysm or arteriovenous malfunction rupture in the brain, resulting in what? Hemorrhagic stroke. Well done, guys. Let's see the next one. The nurse cares for a client in a major stroke center emergency department. Which client with suspected ischemic stroke is a likely candidate for alteplase? That is the TPA that we talked about. Which of the following clients are what? A candidate. 1, the client presenting to the hospital 5 hours after the symptoms onset. 2, the client with blood pressure reading 205/112. 3, the client is currently experiencing heavy menstruation. 4, the client presenting and following a serious motor accident. Which of these clients is a best candidate for alteplase? I've told you there are some exceptions you can't give. So which of these people can you give alteplase? Cosby, were you here with the blood pressure that you've chosen? I told you if the blood pressure anything more than 185, you can't give alteplase. So please, those choosing 2 is a no-no for me, please. Anyway, nice try. Guys, I'm still waiting. We've got 42 people here.
If yes, I'm waiting to see your answer.
Hey.
Why?
Those choosing one, do you remember what I said? So the question is, maybe you guys did not hear the question well. Listen to the question. Don't rush when you are doing the NCLEX. Understanding the question is a number one rule for you to pass the question, the NCLEX. The nurse cares for a client in a major stroke center emergency department. Which client we suspected is ischemic stroke is a likely candidate. So which one of these people can you give the altiplace? Before I told you that with the altiplace, one, you can't give it if the symptoms started more than 4.5 hours ago. You can't give. And this one they said the symptoms started 5 hours. So number one should be out. I told you that if the blood pressure is more than 200 systolic and the diastolic is more than 105 or even 100, you don't give. A client experiencing heavy menstruation can be heavy, but you can give. Can you give or not? Let's put that one aside. A client presenting following a serious motor accident. A patient has had a serious, see the way they've brought a serious to let you know that if a serious motor accident, the patient can have what? Subarachnoid hemorrhage. The patient can be bleeding from what? The accident, head trauma. Is contraindicated. If a patient has had a head trauma, you don't give altiplace. So 4-2 should be out. So the only indication here is the menstruation. How heavy can a woman bleed? You see, that is why I always say that NCLEX is not going to give you definitive that, oh, this patient is having hypertension, this patient is having head injury. So see, the clients presenting to the hospital 5 hours after symptoms onset, altiplace is contraindicated if the client presents to the hospital more than 4.5 hours after symptoms of, because we are laughing, I'll get you. The clients with blood pressure reading 205/112 millimeter per what? Mercury. Altiplace therapy is contraindicated in clients with blood pressure greater than 185 systolic and 110 diastolic. So we can't give altiplace. So the 2-2 is wrong. Let's look at the 3. The client is currently experiencing heavy menstruation. They will just bring the heavy there to just confuse you. But if you know your content that, oh, menstruation, how bad will a woman menstruate anyway? There is no contraindication for altiplace therapy in women experiencing menstruation. So you can give a patient menstruating, you can give altiplace. The client presenting following a serious motor vehicle accident. Altiplace therapy is contraindicated in clients with suspected serious what? Head trauma. The patient has gotten motor accident. The probability of suspecting what? Head trauma is very high. Therefore, you can't give what? Altiplace. We've talked about this not long ago. So the answer is what? 3. Well done, guys. So let's see this one. An older adult who has facial drooping, a weak cough, and absent gag reflex is admitted for treatment. Which action should the nurse implement? 1. Offer small sips of clear fluid. 2. Provide a communication board. 3. Mix oral medication in applesauce. 4. Contact speech language therapist.
I'll close and go home.
Man, no, be careful. Guys, think this patient is having facial drooping, a weak cough, okay, and absent gag reflex. So definitely there is swallowing problem. So on some the one I will hear ankles on they will trick you, sir. You see the people choosing one. They are saying clear fluid. They are not even talking about taking fluid, so one should be out. You can offer sips of fluid, but not clear fluid. Provide a communication board. What is the communication board going to do when it comes to the treatment? There is nowhere it talked about communication. They are talking about your treatment. So I wouldn't have gone for 2 anyway, but I don't want to debunk those taking 2. Mix oral medication with applesauce. No. Contact speech language therapist. The patient is admitted. What will you do? You need to contact your speech and language therapist. So the answer is 4. Okay. So The nurse should recognize the client is exhibiting signs of stroke and should ensure the client remains NP until further assessment is completed to evaluate swallowing, because you need to evaluate the swallowing capacity. There is absent gag reflex. Because we are saying there is no indication the client's ability to communicate is altered. There is nowhere that stated there is problem with communication. That's what I told you. So you can't say that you are going to provide communication, but because nowhere in the question stated anything about communication. So you need to pay attention to details. Understanding the NCLEX question is the number one reason for you to also pass. Pay attention to details. So far as you have a broad knowledge about CVA, does not mean that if something is not stated, you are thinking outside the box. There is nowhere. That's why I said there is nowhere saying communication, any issue with communication. So you wouldn't say that you are providing a communication board. What if the patient can communicate? So number one is to what? They stated that there is an absent gag reflex. The underlining here, answer here is absent gag reflex. So there should be anything going down. You need to assess the swallowing the swallowing capacity before anything is done. The nurse should contact the speech and language pathologist and request an evaluation. A speech language pathologist will evaluate the client's ability to swallow. If dysphagia is present, the nurse should implement additional. Hello guys, can you hear me?
Yes,
Am
we
I
can.
Oh,
Yes,
okay.
we
I
can.
thought I was locked out.
No.
So if dysphagia is present, the nurse should implement additional measures to prevent aspiration and nutrition and promote nutrition. So the nurse cares for a client 3 days after a stroke. It is most important for the nurse to take which action? 1. Instruct the client to push with feet while moving client up in bed. 2. Offer the client soft food on request. 3. Auscultate the client's lung every 4 hours. 4. Observe the client's leg for warm, reddened, and tender areas every 4 hours. The most important, on the way he's saying the most, it means some of them are very important, but which ones of these are very important 3 days after stroke? I'm waiting, guys. Three days after stroke.
What, ma? I'm waiting for your answer.
Hey, it's what, ma?
Schofield. I mean, boy, me mark a credit. Yes, I'm yes. Sammy.
Hmm. Okay, let me see what people are choosing. Most important. So see, if you've attended some of our private class, you know that when we talk about priority, let's look at our ABCDs, our airway, our breathing, our circulation. Let's look at Maslow's hierarchy of needs. In this question, okay, it could be that all the answers are right, but which one of them is most important? Instruct the client to push with the feet while moving up client in bed. So this outcome is not desired, because it may increase intracranial pressure. We know that with stroke there is bleeding, and if you are pushing the feet up while moving, you are increasing pressure, and this can increase the ICP. So 1, I might not have taken it anyway. But let's look at the 2. Offer the client soft food on request. It might be important. It is very important anyway. But let's look at the other ones. Auscultate the client lung every 4 hours to assess if the patient has aspirated or is at risk of aspiration. Let's look at the 4. Observe the client's leg for warm and warm, reddened, and tender area to identify if there is a risk for probably thrombophlebitis due to the immobility, or DVT due to the immobility. But let's see, auscultating the lungs every 4 hours. So we are torn in between 2 answers. Offer the client source food on request. I would have on request, probably the patients might I'm thinking, oh, we are all trying to get the answer, but let's see. Between these two, which one is very important? I would have gone for 3. A lot of people are now going for 3. So let's see. The answer is 3. Okay. The one, just like I said, may indicate increase in intracranial pressure. The 2, they are even saying that they need to assess the swallowing, need to assess the risk of aspiration first before inner oral fluid or foods are what's given. So assessment, outcome desired and okay, decreased oxygen level will increase clients at high risk of aspiration. Hey. Yeah, at high risk of aspiration. Yeah, the 3. So I am thinking that this one is more at higher importance than the second one. Okay, because 3 days we need to even assess her risk of aspiration before we can even see whether he's okay to have soft food or even normal food. Oh, you don't even agree with me. During recovery from CV, a female client is given nothing by mouth to help prevent aspiration, to determine when the client is ready for a liquid. The nurse assesses the client's swallowing ability once each shift. This assessment evaluates which cranial nerve, 1 and 2, or 3 and 5, or 6 and 8, or 9 and 10. Which cranial nerve do we assess for swallowing ability? Very good. So the answer, well done. I'm so happy. So we are looking for the gag, the vagus nerve, and the what? The glossopharyngeal nerve. Well done, guys. I'm so happy you got that. So let's see this one. The nurse is checking the vital signs of a client who received Altiplace therapy 12 hours ago. Which blood pressure result does the nurse recognize as being appropriate for this client? 100/60, 170/100, 190/110. So we've already given the Altiplace. So see, the nurse is checking the of a client who received. We've already given the Altiplace 12 hours ago. Which one of these vital signs do you think is appropriate to help with perfusion? Which of these vital signs? 190/110, 225/105. Which one of them will you go for? Well done. Well done, guys. So the answer is B. The evidence-based recommendation for a maintenance level of blood pressure during the first 24 hours after Altiplace therapy from a stroke is at or below 180/105. The blood pressure should be higher than normal. When you give Altiplace, you expect the blood pressure to be higher than normal, but it shouldn't be as high as what? 185/100, but it should be as high to be adequate enough to what? Perfuse the brain tissues. It should be high enough to what? Perfuse the brain tissues. Okay. Aaron, Sarah, thank you very much for putting the cranial nerves in the page. Okay, thank you. So let's see our last. I don't know if this is the last one or the last but one. A client have ischemic stroke, arrives at the emergency department. The healthcare provider prescribes TPA. Which client statements would be most important to clarify before administering TPA? 1, I can't believe this is happening right after my stomach surgery. 2, I had a concussion after a car accident a year ago. 3, I started noticing my right arm becoming weak approximately an hour ago. 4, I stopped taking my warfarin 4 weeks ago. So understand the question first, okay? Understand the question. They said the patient is having ischemic stroke. It has been brought to the emergency department. You are supposed to give TPA. which statements would be most important to clarify? So which of these statements, if being said, you are not going to give the TPA because you need to clarify because it might be contraindicated to TPA. So which one of these? Those choosing for, you still not gotten the answer. You still not understood my answer. Please, understanding the question alone is part of what the deal. Anything, look at these options. Okay, let's take the 4 that you guys have chosen. I stopped taking warfarin 4 weeks ago. It means the patient, I told you, action is 2 to 5 days. Even after a week, you can give Altiplace. But here he's saying even 4 weeks. Therefore, we can give the TPA. So 4 should be out. You don't need to clarify. I stopped taking warfarin 4 weeks ago. Done deal. You can give this medication. So 4 is out. 3, I started noticing my right arm becoming approximately 1 hour ago. I said you can give Altiplace 2 to 4 hours ago. He started seeing the symptoms 1 hour ago. So 3 is also out. You can give the medication. You don't need to clarify. 3 is out. Let's look at 2. I had a concussion after a car accident a year ago. It's been more than 1 year. If he had any hemorrhage or anything, it would have been ruled out because it happened 1 year ago. But let's look at number 1. I can't believe this is happening right after my stomach surgery. This patient has had a surgery. He has had bleeding after surgery. Stomach surgery is a major surgery and there is bleeding that comes after it. Therefore, I will go for 1. Your content is very important. Take the answers one after the other. Don't just choose because, you've heard warfarin and you will choose. You will always get the NCLEX questions wrong. Understand the question. What are they talking about? The question is saying that which statement will you clarify? Meaning that which statement will warrant me not to give the TPA? Warfarin was stopped 4 weeks ago, meaning I can give TPA. The symptoms started 1 hour ago. I can give TPA. Even if I had concussion after surgery, it is 1 year ago. I can give TPA. But see the number 1. Right after your stomach surgery, you've had this ischemic stroke. So the answer should be number 1. Okay, so TPA dissolves clot and restores perfusion in clients with ischemic stroke. It must be admitted within 3 to 4.5 hours window from the onset of the symptoms for full effectiveness. The nurse assesses for contraindication for TPA due to risk of what? Hemorrhage. 1. The reason why we are saying the 1 is because this patient has had a surgery and the client should not have a history of intracranial hemorrhage or be actively bleeding. Surgery within the last 2 weeks is contraindicated. So if you've had any surgery within the last 2 weeks, it's also contraindicated. At least we also know another one. Any surgery more than that has been in the last 2 weeks of when the incident happened is contraindicated. You don't give TPA. So do we understand what I'm trying to say? So understanding the question, you see people were choosing, those who were choosing 3, I was so disappointed in you because the question is saying that which client statement would be most important to clarify. Why are we clarifying? It means that we can't give the TPA. But 1 hour after the I started noticing the signs and symptoms, I can give TPA. If I've had warfarin 4 weeks ago, I can give TPA. So please, when you go to the NCLEX and any question is given to you, irrespective of how well you studied the condition, understanding the question alone is your go deal to getting your answers correct. If you don't understand the question, or even though you understand what the question is saying, but you don't read it very careful and you start choosing, you are gone. So please, some answers are so cheap that if you had understood it better, it would have been easy for you to gotten your answers. But because you didn't read the question very well, you find yourself at a very tight corner where you'll be choosing wrong answers. Okay, so please, the NCLEX is very doable. It's all about your content. It's all about what you know, and it's all about what practicing and practicing. If you practice and you get your answers wrong, please review them. And one thing that I would say before we stop this question is, if you finish the NCLEX at 85, it is very good. But in case you don't stop at 85, don't panic. Even 85 is even more dangerous than when it don't cut, because at 85, it means 2 things. It's either you've passed or you failed. But the moment 85, the computer don't cut. It means that you are doing something, but you need to redeem yourself. That is when you need to what? Do very well. So 85 is good. It might indicate pass or fail. But if after 85 your computer don't shut, please don't panic. That is when you need to do all your best, because the computer is telling you that I did not cut because you are still doing your best. Keep trying. And all the best. And you are welcome to join our content that we do every Monday, Wednesdays, and Friday. Any question before I bring the class to an end? Okay, Manuel, anything for us?
Let me clap for you. Yeah, so we thank you, 42 people here on Zoom, and we have 19 people. At a point we had 32 people on TikTok as well. So guys, we are grateful that you came. If you want to join our class, you know what to do. Just send us a message on TikTok or send us a message
in our WhatsApp page. You can chat to
yes,
any of the admins, okay? And then
yeah.
you'll be, yeah.
And also, if you go into our TikTok page, you'll see our WhatsApp link in there. You can go into the WhatsApp group through there. All right. Thank you, everyone.
Have a
And
lovely evening.
we are waiting for you.